Okay, welcome to TalkNTeeth. Is everybody there? Hello. How you guys doing? Welcome to TalkNTeeth. We're talking about smiles, we're talking about your health. We're talking about things in reality of dentistry that are going to help you be healthier, live better lives, and have beautiful smiles. Today we got a great panel of experts as usual. Dr. Publio Silva from Comac, Long Island, who's a digital expert in dentistry, a beautiful photographer in dentistry, and a great, great person. I'm so happy to have him. Welcome, Dr. Publio.
Thank you, Dr.
He just opened his office in Comac, Long Island, and he's killing it. It's awesome. It's a beautiful place if you're out in Long Island. Also with me, Dr. Lokesh Rao from Westchester. Westchester's in the house. He's here. What's up, bro? How you doing?
Good to see you.
Great implantologist, great expert in dentistry, and part of our FMR team. And of course, today's episode is about Invisalign, aligners, and digital orthodontics, which is really changing the way dentistry is being made and how it's being treated for patients. And our expert here from Manhattan, Dr. Frank Celenza, a dual specialist in orthodontics and periodontics, has been doing Invisalign and aligners for like 100 years, or like 25, 30 years. Super expert, super nice guy, very smart, very intelligent. So we have to have one of the best to be with us so we can really kind of talk through the points and really understand what's going on. So let me give you a little insight. Thank you, Dr. Frank, for being here.
Fun
Welcome,
to be here.
welcome. So a couple of insights on Invisalign and aligners. The clear aligner market right now has over 175 subscribers in terms of patients who are getting treated this way. And everyone's paying between $5,000 and $10,000 depending on their case. So we're talking about a huge market in the dental community of fixing teeth and getting them straight. There are 10 major companies. There's probably more than that, but the 10 major companies of clear aligners, you can kind of look for them online and see what they are. But this is a huge market. You're talking about a $3.9 billion industry of changing people's teeth and getting straight. The people want straight teeth. They want to look better. A smile when you go into an office, when you go into sales, when you go into kind of speaking, or when you're just talking with your friends, is an important part of who you are, and it defines your face. And that's why 1/3 or sometimes 1/2 of your face is your smile. So without having that in a nice, beautiful way, it's not really good. You gotta fix it. You can be the most beautiful person with the ugliest teeth. It doesn't translate. And on the other side, you may not be the most handsome, proud guy in the world, but your teeth are beautiful. It makes you at a different level when you're talking to people. They've got over 21,000 employees in this company, and of course, publicly traded company, Align Technology.
Not only that, but you know how McDonald's says billions served? Well, Invisalign is now 14 million cases.
That's crazy.
Worldwide, yeah, and expanded. That was actually a year ago.
Yeah, and we're talking about straightening teeth, better smiles, fixing kids. We're going to talk about the differences between regular orthodontic braces and young adults getting Invisalign, and even up to 50, 60-year-old patients who really want to get their teeth smashed. So, again, welcome, Frank. Tell us what your overall thoughts is about aligners technology and what's going on.
Well, I think it's been terrific, and there's no question it's revolutionized orthodontics, brought it to the public eye, helped people realize the advantages both from cosmetics and health in having your teeth straightened and aligned. And it's just opened the market gigantic, and it's a superior way to do it.
So how long have you been doing it? When was your first Align case?
I actually did the first case in Manhattan, and that was 25 years ago.
Incredible.
Awesome.
Yeah.
Incredible.
And I realized immediately from my style of practice, which is strictly adults, that I want to do aligners. I don't want to do braces anymore. So I tried very hard, learned how to do everything with aligners.
And so really, how does it really, tell us, like, for a lay person who doesn't know what it is, like, how does it really help the patient? Like, well, what's really going on when they're using the trays and doing all that stuff?
Well, you start to see results pretty quickly, so it's nice. It's comfortable, it's invisible, and it's effective.
But isn't it, I've heard some patients say when they first start, it kind of hurts in the beginning.
It shouldn't hurt, but yeah, there's an adjustment period like anything else, but it's nothing like the old fixed appliances. My God, when I was a kid and I had braces put on, it was the most uncomfortable thing. And there were emergencies and breakages and so many appointments. It's gotten far easier this way.
Right. Now, I still see kids coming in with their braces. I mean,
Sure.
they're 15, 16. I mean, is that still the normal part of, straightening the teeth when they're younger?
Well, you know, for kids and things like that are undergoing growth and development, it's hard to do that with aligners because you can't forecast how much the person's going to change their stature. So for kids, yeah, oftentimes you still need conventional braces, and for other more sophisticated movements.
So one of the things that always comes to mind when I'm looking at my friends' kids and they are growing, you're not really sure how much they're going to grow.
Yeah.
So is there like a period where they go through the regular braces first and then go through Align stuff?
Two-phase treatment is common, and it's a good idea in many of those cases for exactly that reason.
Yeah.
Yeah.
Publio, what have you seen?
So in that case, would they start with wired braces and then finish with
Yeah,
aligners?
well, frequently,
Or
you
vice
know,
versa?
kids need things like palate expanders, turn the jack screw and all that kind of stuff. And so you're forecasting growth and development. So it's usually braces first, finish up with aligners.
Yeah.
That's for the adolescents you're talking about.
Yeah.
Yeah.
Right. But now you get into the age group of different people. Like, what have you seen there, Doc?
You know, I've seen a lot of patients where, you know, they've got extreme cases and they need multiple phases of treatment, and I've seen cases from both ends of the spectrum. And I agree. There are times when it's an easy case and you can go through, and times when you can.
Well,
you
how does a patient know if they have an easy case? Like, how do they even find an aligner doctor? Like, what's the credentials that they're looking for?
There's
for,
no sound.
For a doctor who's aligning. Like, how do you even get there?
You know,
Okay.
I like to think the time-honored referral from your dentist. Your dentist knows who's getting good results and who they can rely
Yeah,
on.
but listen. I know the public. They're on Googling.
Yeah.
And they're looking for a guy, right? Most people, 30s, 40s, they're online. They're going to find their own doctor by themselves. And, you know, that's what I want. I want to be able to give the people an idea of what should they be looking for to find accredited aligner expert. Because I see people there 2-3 years out and they're experts, you know, and that to me is a little bit, you know, deceptive.
Yeah, well, when you go through Google and all that, pretty effective, but sometimes you wind up with someone who's just good at social marketing and might not be a good orthodontist.
Right. So how does the patient know?
Well, have a consultation and get a good feel. Get a feel for how much experience
Ask
they
a
have.
friend. Ask a friend who's had it, who had a good experience.
Actually, it's the good reason. Good point is that the results should speak for themselves.
Yeah.
So if the doctor has proven cases of routine repetition of good cases being published on their social media, a portfolio of cases and results, I believe that will speak for itself. And if you have all your patients or most of your patients walking and interacting with other patients or friends, those will be referrals, and that's kind of like a good way.
So, you know, we hear people and patients coming in saying, I had aligner technology, I had these trays, it didn't work, I'm very frustrated. So what happens, like, you know, whose fault is it? Is it the patient not being compliant? I mean, sometimes we have patients, they leave, they move to a different city, and now I lose control of the patient, and I don't know what the heck's going on.
Well, it can be a variety of factors. Transferring a case to another city is very easy to do if you go through the channels, and we do that very frequently. Another thing is patients can be on the go and traveling, and you can work around it very easily with aligners. But there's reasons why it might not go according to plan. Usually it's compliance.
Right.
Yeah.
And, I mean, and I think about the college kid who's hanging out at the bar, takes out his aligners, drinks like 3 or 4 beers, and now he's like, where's my aligner? So like, how do they order the aligner after that?
Yeah.
Can they order the aligner back?
Replacements are quick. You can
Okay.
get them in a matter of days.
Okay.
But he's got to call you and tell you he needs it.
Yeah.
He just lets it go.
So if they go
how am I supposed to know?
if they go 2 weeks without like
well, now you're
using
going
it,
backwards.
There's a
right? So
rebound.
now we go back to compliance. So have you seen like the younger patients not complying or the older patients not
Usually, the
complying?
older patient is extremely compliant.
Right.
A, because they came to you because they want it, and
Right.
B, they're paying for it.
Right,
Not
right,
the
right.
parent.
Which
Right.
happens for that 26-year-old, 27-year-old patient who teenage years had ortho, had braces, and stopped wearing their retainers.
Yeah,
And
see
then
that
all
frequently.
their teeth move and have a memory
Yeah,
of their
let's
own.
just
Well-
be really clear. When you start a process of clear aligners with your dentist, and hopefully he or she is trained and has enough years of experience, and I would definitely be asking for befores and afters, right? Okay, you found somebody you think looks good, and you have a phone call, say, do you guys have befores and afters? I want to see that. So once you start the process, you got to commit. You got to commit to it. And I think a point that you made is very important. When the parents are paying for something, the kids are just like not even thinking about it, right? They're on their social media, they're not even thinking about it. They forget their retainer, they lose their retainers. I think it's a big part of it. Compliance, I think, is a big deal.
Oh,
there's,
yeah.
there's no sense in value when they're too young and they're not paying for it.
Right.
But at the same time, Dr. Frank, what is there a limit to the age?
That's always a question that comes up if there's an age limit. And to me, no, because I treat adults and of very significant age groups. The important thing is health. If the dentition is in a good state of health, you can successfully move teeth. But when you move teeth in the presence of disease or pathology, now you're in trouble. So there are things you do to get the patient healthy sometimes first.
As dentists, we understand disease. What if you were speaking to the patient?
Bleeding gums or bad hygiene is terrible for orthodontics. And if they start wearing aligners, it only gets worse. If they're wearing braces, that's even worse.
So should they do it themselves and just?
You need good home care, good
Well,
hygiene.
they got to go for, right? You got to go for a cleaning.
Yeah.
Let's get everything cleaned up before we start any kind of treatment. Again, I see a lot of kids, mid-college, first job at 20s, they got to get a cleaning first. Like, get your teeth cleaned, get everything settled,
At
and
the
now we
very
can
least.
start the problem, the
combine
process.
it with hygiene. And that brings up an interesting other segue into the DIY aligner market.
What is
where the patient
DIY?
Do it yourself.
Okay. Don't even get me started with
because now
that.
there's no examination.
Don't get me started with that.
I thought we were going to start. I thought we were going to start.
Smile Direct Club opened
Out
up.
of business.
Wait, Smile Direct Club opened up.
Out of business.
And
He
I
predicted
said
it.
to
He
my
predicted it.
and I said to my friends and my colleagues, they're like, hey, I'm worried about this Smile Direct Club. It's going to take away some business from my. I said, don't even think about it. Supervised aligned technology is good, and even there's some like messes and things happen. Unsupervised orthodontics, forget it. I knew that was going to be a
I
disaster.
can't tell you how many cases I've had to correct and how many things they missed.
I have a story. Young girl, 25 years old. The father calls me up and says, my daughter's doing this Invisalign thing. I said, is it Invisalign or is it something else? They go, well, she got it online.
Yeah.
And it was really cheap. I said, what do you think is going to her teeth? He goes, yeah, she's calling me because her teeth are moving. 25-year-old, lower teeth moving, unsupervised orthodontics, comes to my office. I don't even know what to do. Literally, they told her to take out her teeth. And I said, no, stop the whole thing. Let's splint everything together. Let's go splinting the retention. And the kids, thank God it went back to normal. And the kid saved his teeth, but they were ready to take out his teeth and put implants in.
I had a case
At 25.
At 25.
I had a case of unsupervised clear aligners, and the patient came in with beautiful straight teeth, and I'm like, wow, what are you here for? He's like, doc, before I had crooked teeth, now I have straight teeth, but I can't even bite on a slice of pizza. And he was hitting in the back teeth, open anterior bites, space in the front. The pizza could not even change.
And the teeth were straight.
Teeth were straight. And
so the point is this. Aligners are not a treatment. They're an appliance.
Right.
It's an appliance. You need to know how to work it and tailor it to treatment.
Right.
It's not automatic.
But tell me about, you finished the case.
Yeah.
It's straight.
Yeah.
Now what do you do to the
Well,
patient?
retention, just like with braces, is always critical, particularly in adults. And particularly right when it's finished, because the teeth remain under tension and they want to go back. So you've got to stabilize it like that, or you won't get a long-term result.
And you were talking about their occlusion. The occlusion is the bite, the way the teeth actually meet. And Dr. Locke had a great point.
Yeah, so when teeth are not in the right position for a prolonged period of time, those teeth are going to wear literally at the point that they're at. And then when you start to move those teeth back into the right position, you're going to start noticing, chipped edges or slanted edges in your teeth. And then it's going to require additional restorative work afterwards, whether it's bonding, veneers, crowns, you name it.
So what's your recommendation after that?
Yeah, so you want it to fit together and really nicely in the end. And I love when I'm working with another dentist who can finalize that last bit of detail with restorative dentistry and other materials like you guys are saying. And you have to direct the patient when to transition over.
We're seeing that a lot now, right?
Sure.
'Cause there's so many patients that have aligners, and they will come in to, they're our patients. We referred them to Frank, and we referred them to get aligners, and they're maybe even in a different city because the kid's traveling. And now they finished a line, they have their retention. Now pay attention to this because it happens, and if you're in treatment with aligners, you got to tell your dentist, when your teeth are closed together, when you finish and you're closed together, there are some teeth that may not be hitting. They may not be occluding and touching. So therefore, there's more pressure on another tooth. So we talk about aligners and orthodontics as a macro movement of teeth, and then the microscopic movement that we put them in, which we call occlusion, which is teeth that are hitting exactly at the same time in a micron level, in a very,
Yeah.
very, very small precision level. You're a
So-
precision guy.
Yeah.
I don't know if I told you, but Dr. Frank is a race car driver. his whole life is precision.
Precise, man.
Okay? And he got to have it right there on that perfect line around that turn. Otherwise, things happen. So you talk about
But I like
precision
that
of
you
that.
say that because frequently orthodontics and aligners are not an end product of itself. You need adjunctive measures, particularly in an adult, to stabilize it, like we're saying, and
We'll
bring
talk
it home.
about that. Multidisciplinary, different people connecting. Talk about that.
My buddy's here. Sometimes we need restorative dentistry. What if the teeth are discolored? What if they're chipped? Well, aligning them isn't the end result.
Yeah.
Get it in the ballpark. I
Right.
say to a lot of my referrers, I'll get it in the ballpark. You bring it home.
Which is 50% of my Invisalign cases, because I
Yeah.
exclusively do Invisalign, end up doing a cosmetic work
Why not?
or restorative, either veneers or crowns. And the reason is because I want to give my patient the opportunity to move the teeth so I don't have to trim or shave or adjust so much.
Less dentistry.
No, not only less dentistry, less harm on the patient's teeth.
Yeah.
Right.
Now, that's one option. But there are times that I have to not do ortho because I know that the patient's not compliant in any way. And I could do the restorative dentistry that way.
If you have any questions, go to TalkNTeeth on Instagram and give us a DM. I'd love to hear if you have any questions while we're here. We have Dr. Frank. We can answer your questions. And thank you for that. I just got a first question from our colleague. And she says, are Invisalign trays sanitary? How do you properly clean them? Great question.
Yeah. Well, yeah, the plastic is very clean. They come with disinfectant. I tell all patients, rinse it off when you take it out of the bag. And
Do
we
you
give
brush
them
it?
brushes.
Do you brush it? Yeah.
And there are cleaners on the market. You can fizz them like a denture in water.
Right.
But it's a great question because hygiene is critical and you want to keep them nice and fresh.
Another question. Can you use insurance for Invisalign?
I would think it depends on your insurance policy. Yeah.
Because I found
Sure.
some of the insurance policies actually have an orthodontic
Removable
component.
appliance therapy.
Okay, great. Another question, thank you. Is there a minimum age? Is there a maximum age?
Maximum, I say no. Minimum, there could be. If there's a lot of growth, because it's all pre-manufactured. You can't tell how much the patient's going to grow.
Okay, great. If you have any questions, go to TalkNTeeth on IG, Instagram, and give us your questions. We're happy to answer them. Okay, going to Dr. Frank, you said you had a story to tell about a
Well,
situation.
there are so many, and the funny thing is when I start a case, when I meet a patient, I take really good, accurate photographs, as we all do, to document. And then months later, I'll pull them up with the patient in the chair, and they're like, I can't believe I used to look like that. I don't remember that.
Yeah,
And
so quickly.
it's very reinforcing when they start to see that, and that helps them follow
the movement
through.
of everything.
Yeah.
So my kid had Invisalign, right? My kid
Okay.
Peter. He had expansion of his arch, slow expansion, not major, which means the teeth have to come out and fill up the smile because the smile is kind of into it.
Fit all the teeth.
He had a little bit of an issue, and I want to know if this happens to it because it happened to my kid. He had a little recession happening on his teeth, so the roots were starting to show. So how do you deal with that? How do you predict it? Can you predict that they're going to have recession?
You should be able to, but with a good diagnosis and an understanding of periodontics and all, sometimes some arches are overexpanded. The jaw can only get so big, and then the
Right.
teeth start to come through. That's why.
How do you deal with that? What would be a good
there are
solution?
measures you can
'Cause I
do.
mean, I have my opinion on that.
Yeah,
but
to be
what's
sure
your-
not to overexpand, strip the teeth a little bit, and ways to gain space. Otherwise, it's not always expansion.
Right.
It's other ways to gain
But
space.
but how do you, once you have it and you have recession, one or two teeth, what's your follow-up treatment there? Because I know I have my opinion, and I want to hear everybody's
Yeah.
opinion. Like, what do you do with the recession?
Well, on a case-by-case basis, it depends on the severity.
Okay.
But there are grafting procedures and reparative procedures that we do perform very reliably. You'd prefer to avoid it.
What
but
do you
we can
think?
recoup it.
What do you do when you see recession after Invisalign case?
The same way. If
Do
I
you do
could-
restorative? Do you do
no,
grafting?
if I could avoid doing any surgical procedures, that I would avoid that.
Right.
I don't like doing the composites that patch up the cervical part of the tooth. It's just they continue to chip.
So we have bonding option if you have recession. Sometimes they get sensitive to teeth. I've heard patients
would
tell me
desensitize
they
that.
get, Doc, I'm really sensitive. What do I do? So now you got to do desensitization or graft tissue. I mean, what do you do on those cases?
If they're a young patient and that exposure is what we call in the smile line or the aesthetic zone, then absolutely I would send them to a specialist first to see if there's any way to get that gum line back up to where we need to. And then if the patient doesn't want to go through with that, then at that point we talk about a restorative option, whether it's veneers or bonding.
Okay, so I have to deal with sensitivity. What's your sensitivity route? Like, what do you do when they have sensitivity? Do you have a certain bonding technique? Do you have a certain procedure? What do you do when sensitivity happens?
In my case, I start with either Gluma, which is desensitizer, but also Excite, which is a dentin bond. We want to protect the patient that way.
Right.
If there has been a history of periodontal disease, we try to get into some fluoride treatment to bring minerals back into that area and just monitor it, just see what really works in that specific case.
Like anything else, you want to get to the root cause. What's the reason?
No pun intended.
Yeah.
What's the root?
We get good results using laser to desensitize teeth too.
Really?
Yeah.
How does that work?
Very comfortably.
Tell me.
Well, the laser is set at a certain wavelength that without damaging
low wavelength?
Yeah, without damaging the neighboring structures at all, can desensitize the tooth if it's inflamed.
Which laser are you using?
Millennium. I'm not supposed to.
Okay. Yeah, you can tell them.
I'm not supposed to mention trade names.
Yes, you are. You can do whatever you want.
Yeah.
Millennium.
Yeah, the lasers have been fantastic.
And you put it on a low setting and you kind of zap the root a little bit?
Very slowly. You don't want to heat the tooth. It's not
So
burning.
it's
and it's not cutting. Laser's not always about cutting.
No.
It's light that penetrates.
Do you think it's actually kind of taking away the dentinal tubule? Like there's little nerves in your teeth. You know, some of you have experienced, you bite into something, you get like a shock, or you have a cold ice cream and you get a shock. That's your actual microscopic nerve at the end of your tooth where it goes into the root that starts hurting. So you think it's kind of just zapping the nerves?
Well, what a laser does is it penetrates an inflamed tissue and shrinks it. So when the nerve is inflamed and expanded, it's hypersensitive.
Is what you're using, and you get pretty good results.
Really nice, yeah.
Okay.
And it may not just be one shot, a couple of
Several
visits.
phases of therapy.
If I may join in there, I've got a different laser that also, it's a different type of laser. And what that does is it actually creates a smear layer. It's almost like a very expensive tube of Sensodyne.
Right.
But it works really well. I've had a patient, actually my assistant, never able to eat soft serve ice cream. The day I did it, I got a picture on my phone. She's eating a big cone of vanilla.
And by the way, if you have sensitive teeth, one of the things we talked about, PSA, public service announcement, Sensodyne as a toothpaste has what's called potassium nitrate in it. And potassium nitrate at a high concentration will recede those nerve endings. We have, as dentists, a special material called a dentin bonding area. It's called Excite, that we can put that even on your desensitize the patient. This is what I do, which is a high concentration of potassium nitrate, which actually desensitizes. So for the dentists out there, get your Excite. I usually dry it out, put up a little bit of layer, I cure it, and that brings the sensitivity down about 50%, not 100%, but about 50%.
But I have to say, sensitivity post-orthodontics is not a common occurrence.
Okay.
It's not that common. I mean, if it goes back to proper diagnosis and treatment in the right direction, there are things we can do to forecast when you're experienced and
Talking about experience, should a GP be saying that they are the best in the West and they are super at
Well, I know.
That's a problem. It's a problem. It's a problem.
Well, no, I do know some extremely competent general practitioners doing Invisalign and orthodontic therapy successfully,
again,
but they're well trained.
Well, that's the whole thing.
Yeah,
They don't just jump in and take a weekend course and get going. Put the time in.
But is there an accreditation kind of thing, and an aligner accreditation? Is there some kind of how many hours or cases they've done that they say, hey, I've done 200 cases, I got an award, and I got
Invisalign has attempted to
qualify,
establish tiers of experience.
Okay.
And they do. But that's why someone is accredited as an orthodontist or not. The Dental Association takes care of that.
There's a lot of general dentists doing it, and I don't have a problem with that. What I would like to see in my profession, again, is public information. I've started Invisalign. I've done 100 cases. This is my results.
Yeah.
I've done 50 cases, but I have great results. I don't have a problem with that, how many cases you've done. But show me your results. As a patient, I want to see your results. So now I can distinguish what I'm talking about.
There's a lot to be said in numbers. Okay, if you see a dentist and he's done 25 cases, well, he's probably not getting good results and he's timid. You see another dentist who's done over 2,000, well, he's seeing it through and getting it to work.
Yeah. He has a system, and it's part of the coaching, it's part of the training.
Yeah.
Right.
I'm not the same dentist I was when I had my first 5-10 Invisalign cases. I made a lot of mistakes where I had to look back and say, how can I fix this? But once I got into the hundreds, 200 cases a year, it was like, okay, no, there's more to this. There's consistency. There's understanding the patient, selecting the right cases.
Right.
You know, so for dentists out there that feel that their general dentists are competing with the orthodontist, it's the other way around. My orthodontist was happy that I was doing more Invisalign cases because he was getting the right cases referred to him.
Right.
He was getting, hey,
Well, that's another thing.
he's like,
Yeah.
Publio, what are you doing? You're sending me a lot of your Invisalign cases. I'm like, yeah, I know that this is my limit,
Right.
and you could make me do a better job.
That's the best
And
takeaway
that's
message.
Yeah, I
There's
like that.
cases that we just can't do. Your position as a professional is to figure out, this is my comfort zone. I can really do this really well, and this is the stuff I'm going to refer out. If everybody did that, I think the people and the patients would be better off care. When you say, I'm going to do everything, you're going to make mistakes.
And that comes with experience.
Yeah.
You know, I had a lot of cases that were slam dunk, 18 months in and out
Which
case.
comes to the next question. What is the average time for a 25 to 35-year-old doing Invisalign to straighten a teeth? What's your average time? I know you can't say one
Well, it
versus the
depends
other.
on the case.
Depends on the case.
But to your point, the untrained eye sometimes doesn't spot where the problem area is going to be.
At the beginning.
And that's when
At the
they get into
beginning.
trouble. And now it's 6 months, 9 months later, and it's not going well. Well, you should have seen that when you started.
Right.
Well, my favorite, I'm sorry to laugh, my favorite thing is when the patient comes in and she says, I've had Invisalign. And my first question is, how long have you been in Invisalign? And when they say 12 months, 18 months, okay. When they say 4 years,
Oh my God.
it's a problem.
Yeah.
It's a problem.
Nothing takes
And
4
I don't
years.
react to it, but I said, oh, really? And how is that working for you?
Well,
And it's-
sometimes they're
it's-
including retention.
But it's those
But
cases.
no, but they
yeah.
don't look like they're
It's those cases that we learn from.
Yeah.
You know, and we realize there is a limit.
Okay.
Go
ahead.
I actually also at the beginning of my learning curve, almost where Publio was back when he started. And what I do is, as a routine, is to make sure that I contact my orthodontist and they go over my cases with me.
Wow.
Okay, we got a really good question from one of the doctor students at NYU. And he says, as a dental student or a young dentist, what age do I tell patients or tell my younger patients to do the ortho consult? And what's the best way to start orthodontics? What's the best age after young adults, like after 17, to start orthodontics? Is it 17, 20, 21? Should they wait till they're 25 and they've grown? Should they wait till they're 30 and then do it? I mean, there's a growth process.
There's no set answer for that. It depends on
Okay.
the situation on the case. There are many young children, if they get treated early, can avoid a bigger problem later.
Right.
Yes.
You know,
Right.
and
Well,
sometimes
some-
let it
And
go, we'll do it.
sometimes,
But
and I
also-
want to bring up the point, like my daughter had skeletal problems. So you have not only the teeth are in crowded position, but there's a skeletal problem. And that needs to be addressed by, to me, that's an orthodontist situation. It's not an Invisalign case.
That's a growth and
It's
development
or
case.
growth and development case. Get them to the point where they're 17, 18 years old. Now you've helped the cranium and the skeletal things get into the right position, and then we fine-tuned it with a little Invisalign, and now she's got a brilliant smile. I mean, beautiful smile.
She's gorgeous.
She is.
Saw her last week.
And, and now, so skeletal issues, and that's why I think, my opinion, if it's my kid between 14 and 17, I want a full orthodontic evaluation, and then I can figure out which way they're going to go, Invisalign or just, fix a couple of teeth.
I want to clarify one thing is that also it's case selective, not just how complicated the dentistry is, but also the patient.
Sure.
So I ask the parents, I'll ask them in the chair when they're making a decision for their child, does your child do their homework on time? Are they compliant with a task? Do they clean up after their rooms? Like, are they neat and follow those steps and the rules? And they say yes, perfect. That is the patient that I want to see do aligner therapy, because I am giving them a box of aligners to take home, and hopefully they wear it.
See through.
Right.
And exactly.
Right.
It could go a year and not wear them.
All right, let's talk about, you've done the Invisalign, it's been 18 months, the patient's happy, their occlusion's good. What's their next step? What's how do we keep the teeth where they are? Because I've always heard this term, and I've seen it in my practice, relapse. How do we prevent relapse? How do we keep the teeth in the right position?
Yeah. Well, the nature of relapse, orthodontic relapse, is that the teeth want to go back where they were.
Muscle
So
memory.
you gear it accordingly. Depending on the movement, the direction of movement, there are things we do to stabilize it, including your bite adjustments and sometimes restorative dentistry. But also the design of the retainer is geared for that. And then there are procedures we can do to eliminate the tension and speed things up. But stability is very important. And in my mindset, if you move it, you got to retain it, particularly in adults.
Talk about 3 different types of retention.
So there are removable retainers, which is
Right.
like the aligners that we're talking about, but now in this case, stabilizing, not actively moving. Then there are fixed retainers, which are bonded
I
or
like,
cemented
which
into
I
place,
like.
and I use universally depending on the case and
I
the location.
I like
of
wires.
course. And then there's dentistry to stabilize the teeth,
Right.
restorative dentistry that we're talking about.
Right.
And sometimes that's
I don't know. I'm a little bit crazy, and I tell my patients, hey, you finished orthodontic, you finished Invisalign, get a fixed retainer. And they say, well, I want to be able to floss, and I can't get through on the retainer. And
Okay.
I'm like, keep the teeth straight for at least, I don't know, 5 years, 10 years, fixed retention.
depends on the case.
And then you could take them off later. But I don't want to think, I've had cases relapse.
Yeah, unless you did the orthodontics, you shouldn't be telling them that. The guy who did it should be doing that.
I know, but they're coming back for
But-
cleanings, and I'm
Many
like, wait a
times-
minute.
Many
you know.
times they relapse after they've had their veneers done. What do you do in that case, Dr. Dean?
Well, listen, don't get me started with that.
Yeah.
So a lot of times we have patients with dark teeth and they're crooked. Frank will Invisalign them, liner position. I make the veneers on them. I'll make a beautiful smile makeover. I get extremely nervous that they're going to move, and I get fixed retention, and they're fighting with me because I've had that happen. They have the orthodontics done. They have aligners. I put veneers on. We had a beautiful cosmetic case. They look amazing. And then 3 years later, the tooth moved.
Yeah, well.
Now he's got to go back to aligners. She's upset. I'm sorry. I told you to get fixed retention. You didn't listen to me. So this whole thing becomes a problem for our profession as dentists. We're trying to do the best for the patient, but sometimes they don't listen, and then it's a problem.
Yeah.
There are measures we take to get it done properly.
There's measures we take.
Wow.
We do
Yeah,
things.
but that takes, as you're saying, it takes a little bit of direction
Yeah.
and keeping
Yeah,
the
I
patient
like,
on track.
ladies and gentlemen, I like fixed retention. I like a nice bar. Now you're doing titanium bar like the way you showed me with
Yeah.
a scanner. Let's talk about
scanning.
that. Let's talk about aligner and impressions that we were taking 20 years ago.
Right.
What are we doing today? We're doing scanning, right?
Oh my God! Well, this is a digital manufacturing technique, and you want to harness that from the beginning, including the impressioning stage. For aligners to be effective, they're dependent on a very accurate fit. They have to fit beautifully. If you're doing it from an impression, let alone one that you took in your living room,
Right.
it's just not going to work that well.
Right. But the digital scanners, for me, have
Oh, they're
changed.
fantastic.
Our digital technology, your digital
But not
technology.
only the digital technology of scanning of the impression, but the manufacturer of the
All the
aligner
way
therapy,
through, 3D printing.
especially Invisalign, because they're the top dogs in the industry. They are delivering results with the G-force and the movement, and they understand the anchorage of moving roots. So they are the ones who have the repetition.
Yeah.
They have the numbers.
Invisalign is the largest 3D printing company in the world.
Right. And I want to make an announcement. We have, in Manhattan, the first, by the way, it's also at Nova University where my daughter goes to dental school. We have the first 3D facial scanner, which is called which is called RayFace, and they are now importing that into aligner technology. I mean, if you really think about it, you're trying to put teeth in the perfect position for the teeth and the bite, but it's got to fit the face. So 3D facial scanning for me is paramount, and I'm happy to say we're the first office in Manhattan, probably in New York, that got the RayFace because of that reason. Yeah. We have aligner patients, we have implant patients that he's been working on, we have smile makeovers. We have to make the teeth fit the face. So having the face inside the laboratory and inside our computer, now I can see everything that I'm going to put the teeth in the right position
really cool.
with the occlusion. And again, it's really cool, but it's also making things much more predictable for us. So a huge thank you to American RayFace, who's brought this technology to market.
And that's a good way of educating our dentist. Moving teeth is not just about getting teeth aligned and having a good bite, because when you show those teeth on the patient's face, they could be off the midline. They could be canted. And that's something that the restorative dentist and the orthodontist or the GP doing Invisalign has to understand. Where is the final position once you're done with Invisalign? And having the face, and now the 3D facial scan, it's just going to be amazing.
Okay, next question. Who is not a candidate for aligners?
You asking him?
I'm asking you.
Oh. Well, first and foremost, if there's pathology present, disease, bleeding gums, loose teeth, fractured
Infected teeth.
like anything else. Anytime there's disease present, you got to clear that up first. And that's why this take-home thing misses the boat, because nobody's looking.
What about missing teeth?
Well, that's not a limitation. Sometimes we're setting up teeth and moving and rearranging the space to receive an implant, to receive a bridge. It's a big part of it.
Let's tell everybody,
Yeah.
Dr. Frank was the first one to place an implant in a patient and use the implant as anchorage to move the teeth. That was amazing 20 years ago when you did that. It was amazing.
I wasn't the first, but
We
developed
You
it.
were top.
We
You were
developed it,
one of the first
thank you.
leaders
And we
of
still
it.
do. So sequencing of multidiscipline, when there are other specialists involved, sequencing that together is important.
Yeah, that's great.
Many dentists who are restoring cases, smile makeovers, and have the relationship with orthodontists are afraid of letting that go, that power go, or that control go,
Well, it's an
because
ego
their
thing.
orthodontist doesn't know.
Ego
Where to
in
move.
dentistry? I
Yeah.
never heard of it.
No, me either. Well, I'm trained as an interdisciplinary provider, and I love talking with guys like you and coordinating and working together. That's what it's about.
Yeah.
You had a good story to tell.
Have several. One of the biggest challenging cases I had with Invisalign, I had a patient who really believed that it was possible. She was compliant, she was motivated, she was interested. And the life-changing results that in 18 months, realigning her teeth gave her the confidence. I was like blown away. I'm like, definitely. And don't get me wrong, those teeth were worn down, had composites on top of them. They were gray. They were not even in a good aesthetically, right? But when she saw them nice in the line and she was able to smile, not hide behind a mask, it was life-changing.
It's so satisfying.
Yeah, I get the text selfies from Christmas. Thank you.
You got a bad one?
Yeah.
All right, go ahead.
I'm feeling bad about a woman I treated, lovely lady, concerned about her appearance, always dressed nice, beautiful hair, she had beautiful skin, nicer, but she says, I can't smile. I don't smile. I don't like my hair. I took a look. I said, yeah, really hard case. But I got her going and kept her motivated and saw it through, and she knew from the beginning there's going to be another dentist when I'm done.
Right.
You got to go through with this second part, and
Right.
I'll direct you. And when she got this, you just, I don't want to do it. I don't want to do it. I said, you got to do it. Now's the
Right,
time.
he got you all the way
We worked
there.
so hard to get it right.
Yeah.
It was a hard case, and she's just not following through. And I see it getting undone.
And you just want to get the teeth fixed.
I'm like, please, this will be life changing. You'll be when
And
you
it's-
smile, you'll be gorgeous. And she won't.
She won't do it.
She's too
so it's
timid.
funny. I just got another question. After orthodontics, after aligners, can you use bonding? Can you use little bonding and composite to actually fix the teeth, to actually make them touch? Or again, they can't afford a $20,000 smile makeover. Can we do just some bonding to get them aesthetically? Right? I mean,
Which I said,
that's a good question.
50% of my Invisalign cases are usually given the final touch with restorative dentistry.
Right.
Small
A bonding, a little
small
bonding. Yeah,
in the
sometimes it's just
edges,
a little bit.
One veneer, two veneers.
Right.
Nothing crazy.
Case
Right.
by case.
Yeah.
It's a
yeah.
case by case basis.
Yeah. Okay. Well, I think we talked about a lot of stuff.
Yeah, we covered
I hope
ground.
I hope you got a lot out of that. Our next episode is April 26th. It's a Saturday. Big announcement. Ready? Canines and felines and their teeth. We're going to talk about dogs and cats and how you can keep your pets' teeth clean. How to take care of them, how to clean them yourself, how to examine your pet and take a look and see how you can help them. Because pets have a dental problem. I hear a lot of times the cat's teeth are falling out when they're eating, or they're playing with their dog and their ball, and the ball ate the ball and the tooth falls out. And they're like, what do I do? And I'll tell you something, dentistry for pets is very similar to dentistry for humans. You need a specialist to get in there and clean them up.
Not
And,
me.
Not you. No Invisalign for the dog, but they need care. They really, really need care.
They do.
I want to thank everybody for joining us. Hopefully you can listen. If you're not here live, you can listen to it later. Any questions, you can still DM us later. If you have special questions about your case, or if you have photos about your case and you want to help, doesn't matter where you are in the U.S., we're happy to refer you to people that we know. We have a big group of specialists around the country to guide you into the right hands to make sure that your dental health is great. Dr. Publio, Dr. Locke, Dr. Frank, thank you so much for being with us. And I'll see you guys next time.
That was fun.
All the best. Take care.